If you have an enlarged prostate, you need to supplement the following 5 essential vitamins. You will discover many interesting things from a small but useful seed to help an enlarged prostate return to normal size and improve urine flow. You will also discover simple lifestyle changes that can be made to solve the problem at its root. Zinc. Zinc is an important constituent of prostatic fluid and is known to play an important role in the development and normal functioning of the prostate that men with enlarged prostates should consider it their number one priority. Zinc has anti-inflammatory effects and helps inhibit the conversion of testosterone into dihydrotestosterone, DHT. In some men, DHT may contribute to prostate enlargement, so reducing this conversion through zinc can help limit prostate growth. In addition, zinc stimulates apoptosis, or programmed cell death in prostate cells, which supports the shrinking of an enlarged prostate and helps prevent further growth. An important thing, your prostate contains more zinc than any other organ in your body. A healthy prostate tissue has zinc concentrations that are 10 to 15 times higher than other soft tissues. But here's the problem. As men age, zinc levels in the prostate drop dramatically, and this deficiency directly contributes to prostate enlargement. A lack of zinc may lead to reduced testosterone levels, decreased sperm count, erectile dysfunction, hair loss, weakened immunity, and slower wound healing. Taking zinc supplements can enhance immune function, which in turn may lower inflammation and help reduce prostate enlargement. A groundbreaking 2011 study published in the Indian Journal of Urology examined zinc levels in men with and without enlarged prostates. The researchers found that men with lower blood zinc levels had significantly higher rates of benign prostatic hyperplasia and were at increased risk for prostate cancer. Now, you can find zinc in foods like oysters, red meat, and chicken, but there's one source that stands out above all others for prostate health: pumpkin seeds. A single ounce of pumpkin seeds contains about 2.2 milligrams of highly bioavailable zinc. Plus, they contain other prostate-supporting compounds we'll discuss later. For optimal results, consume 10 to 20 grams of raw dried pumpkin seeds daily. That's roughly 1 to 2 tablespoons. You can also use cold-pressed pumpkin seed oil, about 1 to 2 teaspoons per day, mixed into salads or added to cooked dishes after cooking to preserve the nutrients. However, some clinical studies have used higher therapeutic doses of 50 to 100 milligrams of zinc daily for men with enlarged prostates. But here's a critical warning: taking too much zinc can cause nausea, vomiting, diarrhea, and can actually interfere with copper absorption, leading to other health problems. Always consult your healthcare provider before taking high-dose zinc supplements. Phytosterols. Pumpkin seeds also contain another important vitamin called phytosterol, a natural compound found in plants that can help you safely lower your cholesterol levels to avoid health risks such as heart attack and stroke. The main mechanism of action of phytosterols is to compete with cholesterol during absorption in the small intestine. Thanks to that, they help reduce bad cholesterol, LDL, in the blood by about 7 to 10% when supplemented regularly at a dose of about 2 g per day. Major health organizations such as the FDA, USA, have also recognized this role and allow labeling of products containing phytosterols with the claim may help reduce the risk of heart disease when used in a diet low in saturated fat and cholesterol. In addition to cardiovascular effects, phytosterols, especially beta-sitosterol found in pumpkin seeds, have been studied for their ability to improve symptoms of benign prostatic hyperplasia, BPH. Some clinical trials have shown that beta-sitosterol may improve urinary flow and reduce discomfort. As a result, major urological associations such as the American Urological Association, AUA, do not currently recommend phytosterols as a formal treatment option for BPH, but rather view them as an adjunct. Plus, many people are interested in using phytosterols to limit hair loss due to DHT imbalance, a hormone associated with male pattern baldness. The hypothesized mechanism is that phytosterols may inhibit the enzyme 5-alpha reductase, thereby reducing the conversion of testosterone to DHT. Another important point is how to incorporate pumpkin seeds into your daily diet to supplement phytosterols. Eating pumpkin seeds in main meals or snacks helps the body absorb fat and phytosterols better. When combined with green vegetables and whole grains, the amount of fiber will help regulate blood cholesterol, improve heart health and circulation, factors closely related to the prostate. On the contrary, it is necessary to limit eating pumpkin seeds that are too salty because it can cause water retention and seriously affect the urinary system. Vitamin E. However, prostate enlargement is also a process closely related to chronic inflammation. Prolonged inflammatory reactions in the prostate can promote cell proliferation and aggravate urinary symptoms. Here, pumpkin seeds show their role as a powerful anti-inflammatory warrior. They are a rich source of antioxidants such as vitamin E, especially the gamma tocopherol form, which is more effective than the common alpha tocopherol form, carotenoids, and phenolic compounds. These substances act like an army, hunting down and neutralizing harmful free radicals, reducing oxidative stress, one of the causes of inflammation. Thanks to that, they help soothe inflammatory reactions in the prostate, not only contributing to slowing the growth of the gland, but also helping to reduce swelling, reduce pressure on the urethra, bringing significant improvement in symptoms for patients. Chronic inflammation is one of the primary drivers of prostate enlargement. When your prostate tissue remains inflamed for extended periods, it promotes cell proliferation and worsens urinary symptoms. A study published in the Journal of Urology found that men with BPH who took vitamin E supplements had significantly less prostate inflammation than those who didn't. But here's the thing, the most effective results came from natural supplements rich in vitamin E, not cheap supplements. Vitamin E is also a powerful antioxidant that helps protect cells from damage caused by free radicals. Free radicals are unstable molecules that can cause oxidative stress, which has been linked to the development of BPH. By neutralizing free radicals, vitamin E may help prevent or slow prostate growth. Additionally, vitamin E helps regulate hormone levels, particularly by supporting healthy testosterone balance and reducing the conversion to DHT. Poor blood circulation to the prostate can also contribute to enlargement, and vitamin E helps improve blood flow to this critical area. If you want to try taking a vitamin E supplement to treat BPH, look for a high-quality supplement from a reputable brand. The recommended daily dose of vitamin E for adults is 15 milligrams, but higher doses may be needed for therapeutic purposes. Be sure to follow the instructions on the label. Adding vitamin E to your diet through pumpkin seeds can be a simple start. A morning smoothie with yogurt, banana, and pumpkin seed powder, a lunchtime salad with greens sprinkled with roasted seeds, and a spoonful of pumpkin seed oil mixed into soup or rice in the evening are all easy options. This way of using is both versatile and ensures a full supply of beneficial compounds, helping to maintain long-term effectiveness in supporting the shrinkage of an enlarged prostate and improving men's health. If you don't want to use pills or supplements to get these vitamins, I made a video about 5 fruits rich in vitamins that help improve circulation and health after 60. I will leave the link in the comment section for you to refer to. This next vitamin doesn't just protect your existing prostate tissue, it actually helps rebuild and strengthen it from the inside out. Plus, it has a surprising ability to regulate the exact hormones that cause prostate enlargement in the first place. Vitamin C. One of the ways to manage an enlarged prostate is through lifestyle changes, including dietary modifications. Vitamin C might seem like a simple immune system booster, but for prostate health, it's actually a sophisticated hormone regulator and tissue protector that most men completely overlook. This water-soluble vitamin plays multiple crucial roles in maintaining a healthy prostate size and function. First, vitamin C has potent anti-inflammatory properties that directly target the type of inflammation occurring in enlarged prostates. Unlike general anti-inflammatory medications that can have side effects, vitamin C naturally reduces inflammatory markers while supporting overall tissue health. As a powerful antioxidant, vitamin C neutralizes free radicals that damage prostate cells and contribute to abnormal growth. But here's what makes vitamin C unique. It specifically helps regenerate other antioxidants like vitamin E, creating a protective network around your prostate tissue. One of the important roles of vitamin C in prostate health is collagen synthesis. Collagen is a structural protein that provides support and elasticity to all tissues, including the prostate. As you age, natural collagen production decreases, which may contribute to changes in prostate structure and function. Adequate vitamin C intake helps maintain the structural integrity of prostate tissue, potentially preventing excessive enlargement. But perhaps most importantly, vitamin C helps regulate hormone levels and reduces the conversion of testosterone to DHT. Remember, DHT is the primary hormone driving prostate growth, so anything that reduces this conversion can help prevent further enlargement and may even help shrink existing overgrowth. You can get vitamin C from citrus fruits, berries, Brussels sprouts, cauliflower, broccoli, cabbage, kale, and spinach. However, when choosing a vitamin C supplement, consider natural forms like acerola cherry extract rather than synthetic ascorbic acid, as natural forms tend to be better absorbed and utilized by your body. For prostate health, aim for 500 to 1,000 milligrams of vitamin C daily from a combination of food sources and supplements. Divide this throughout the day, since vitamin C is water-soluble and your body can't store excess amounts. This fifth vitamin is so powerful that it's been shown to not only help shrink enlarged prostates, but also dramatically reduce prostate cancer risk. Here's the fascinating part. Most men are preparing this vitamin completely wrong, missing out on 75% of its prostate protecting power. Right after that, as promised, I will reveal a complete action plan that is incredibly simple but produces amazing results. Lycopene. The fifth and vitamin compound on our list is lycopene, a carotenoid that gives tomatoes, watermelons, and pink grapefruits their red color. But lycopene is much more than just a plant pigment. It's one of the most researched compounds for prostate health and cancer prevention. Lycopene works by balancing testosterone levels and reducing the hormonal imbalances that contribute to prostate enlargement. As men age, testosterone levels naturally decrease while estrogen levels can increase, creating a hormonal environment that promotes prostate growth. Lycopene helps restore this balance, which is particularly beneficial for aging men. A massive 2017 meta-analysis that examined data from 692,000 people concluded that men with higher lycopene levels were significantly less likely to develop prostate cancer. But lycopene doesn't just prevent cancer. Studies show it can actually help reduce PSA levels, decrease prostate size, and improve overall prostate function. Here's the crucial part most people miss. How you prepare lycopene-rich foods dramatically affects how much your body can actually use. Raw tomatoes contain lycopene, But cooking tomatoes makes the lycopene 4 times more bioavailable. This means your body can absorb and utilize 4 times more of this prostate-protecting compound from cooked tomatoes compared to raw ones. The best sources of lycopene include tomatoes, especially cooked tomato products like tomato sauce, tomato paste, and tomato soup. You'll also find lycopene in watermelon, pink grapefruit, guava, and papaya. For maximum benefit, try to include cooked tomato products in your diet several times per week. Start incorporating homemade tomato-based dishes into your regular meal rotation. A simple marinara sauce, vegetable soup with tomato base, or even adding tomato paste to your cooking can significantly increase your lycopene intake. The key is making this a consistent habit rather than an occasional addition to your diet. Now you understand how these 5 vitamins work together to treat an enlarged prostate from many angles. But what makes the difference in seeing noticeable results are lifestyle changes that can multiply the effectiveness of these vitamins. Lifestyle integration strategies. Now, let me share 6 critical lifestyle changes that can amplify the benefits of these nutrients and help shrink your enlarged prostate naturally. First, consume organic cruciferous vegetables daily. Vegetables like broccoli, kale, cabbage, and Brussels sprouts contain phytonutrients that help your liver eliminate excess hormones and produce more antioxidants specifically for prostate health. Try to include at least 1 serving of these vegetables with each meal. Second, make pumpkin seeds a daily habit. As we've discussed, these tiny powerhouses contain zinc, phytosterols, and vitamin E, all in one convenient package. Keep a small container of raw pumpkin seeds at your desk, in your car, or wherever you might want a healthy snack. Third, eliminate inflammatory vegetable oils from your diet and replace them with anti-inflammatory fats. Swap out corn oil, soybean oil, and other processed vegetable oils for extra virgin olive oil, avocado oil, or raw coconut oil. Also consider reducing or eliminating dairy products, as they can contribute to prostate inflammation in some men. Fourth, incorporate high-intensity interval training twice per week. This type of exercise helps optimize testosterone levels, reduce inflammatory hormones, and burn excess blood sugar that can contribute to prostate inflammation. Even 20-30-minute sessions can make a significant difference. Fifth, eliminate processed foods, especially those high in sugar and refined carbohydrates. Replace bread, cereals, pastries, and sugary snacks with whole foods like grass-fed beef, wild salmon, avocados, and the vegetables we've already discussed. These foods actively promote prostate health rather than working against it. Finally, consider intermittent fasting if you're carrying excess weight around your midsection or consume alcohol regularly. Excess abdominal fat and regular alcohol consumption can indicate fatty liver, which disrupts hormone metabolism and increases inflammation throughout your body, including your prostate. Conclusion. My name is Dr. Laura. For over 25 years, I have dedicated my research and expertise to helping men and women over 60 regain their health and confidence. I've covered 5 powerful vitamins that clinical research shows can help shrink enlarged prostates. The remarkable thing about pumpkin seeds is that they contain 4 of these 5 compounds, making them perhaps nature's most complete prostate health food. Remember, consistency is key. These aren't quick fixes, but rather long-term strategies that work best when maintained over several months. Start by adding 1 or 2 tablespoons of raw pumpkin seeds to your daily routine. Include more cooked tomato products in your meals, and gradually implement the lifestyle changes that resonate with you. If you found this information helpful, make sure you're subscribed to get my latest videos on natural health solutions that actually work. Share your experience in the comments below. I read every comment and often create videos addressing your specific questions and concerns.